Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. Arkansas reached something of a milestone this week, though this week was later than most doctors and the governor had hoped. Half our state's eligible population has now been vaccinated against COVID-19. Not as many as most doctors and the governor had hoped. More on that, plus the pandemic and Arkansas schools later in the program. First, another element of the coronavirus era. The Biden administration's executive order mandating the nation's larger businesses to require their workers to be vaccinated or be tested weekly. Reaction has ranged from outrage to out-and-out support, and something in between. Joining us now, Mike Preston, Governor Hutchinson's Commerce Secretary, and Randy Zook, CEO of the Arkansas Chamber of Commerce. Secretary Preston, we'll begin with you. Your boss, Governor Hutchinson, has said that it's just the administration has gone too far, that it's going to stiffen the opposition to vaccination and to masking. Any regrets 1 week later? Any weakening of that?
Yeah, no, I completely support what the governor said on that. I think it is going to have the opposite effect of, mandating that businesses of 100 employees or larger have to give the vaccine. I think it's going to have the opposite effect of people not wanting to. We're trying to, as long as this has been around, been a voluntary thing. Now it's strongly encouraged, and I've got the vaccine. I encourage my employees to do so, but certainly I can't mandate that they do so. I also, on the counter side of that, don't think that the government should come in and tell a business that they can't require it. If a business wants to choose to do so on their own accord, then absolutely they should be allowed to. And if the individual chooses not to, and they don't have an exemption or a reason to be able to opt out, then it's up to the business. If they want to terminate that employee, they should be able to. But I do think it was an overreach of the Biden administration to come in and do this.
Obviously, this thing is headed for the already is. It's headed for the courts. Your thoughts on the constitutionality of Mr. Biden's position, of the administration's position?
Well, I'm not a judge, and I hate to try and rule on it. Obviously, I have my personal opinion and my beliefs on it. As I read it and think the constitutionality of it, I don't think that there's going to be the ability to for it to go through the courts. But I've been proven wrong before, and I do suspect the courts will weigh in pretty quick time on this, as it's a very pressing issue in front of us. And likely the courts will probably uphold what the president's executive order was.
Well, Randy Zook.
Tough question. It's unsettled, as Mike said, needs to be in the courts. It's going to have to be decided finally in the courts. So we're urging our members to take a deep breath, slow down, wait. It'll be resolved. It could be several months, during which time a lot more people are going to be vaccinated. Insistence by some employers is having an impact, and some of these things like financial incentives or penalties around health insurance premiums are going to have a lot more impact over the next few months while the issue is resolved in the courts. Well, but it's clearly a Supreme Court decision that's going to be required.
Your counsel or other counsel to your members, what are they telling you? I mean, is this an extra constitutional move by the administration?
It's about half and half, and it's been quite muted, frankly. I'm surprised that we haven't heard a lot more, real concerns. But I think people realize that it is going to have to go through the courts, and this is several months down the road before it's going to be decided. Once it goes through the processes of appeal, filing, appeal, and appeal to the Supreme. So hold on. Nothing's going to happen until the Supreme Court makes a decision. It's a tough issue, I know, for a lot of employers, but it's not so tough for others. And when you start talking about OSHA has clearly been upheld as the arbiter of rules in the workplace. And the reading of the law around OSHA requires employers to prevent or fix or remedy or avoid anything that creates possibility of death or serious injury in the workplace. Now, a long way from here to there, but tough issue.
Yeah. You want to take that? Well, I think that's the Attorney General there, right?
It is the Attorney General.
Well, is Randy's? Do I hear Randy Zook saying, "Get ready"?
Be prepared. Yeah, absolutely. Depends on how the thing gets resolved, one way or the other. But be prepared for whatever might happen.
Okay. The Business Roundtable, which is a major spokes organization, representative for American business, issued a lengthy statement within hours of the administration's, and here's the operative clause. Business Roundtable applauds the administration for its leadership and continued efforts to defeat the pandemic. We share the administration's goal of getting as many eligible Americans vaccinated as quickly as possible, which is key to combating COVID, keeping vulnerable Americans safe, and accelerating the economic recovery. Secretary Preston, back to you. It sounds like that aspect, anyway, of corporate America is behind the administration. Or is the Arkansas administration out of touch?
I don't think we're out of touch by any means. I think we've had great conversations with the industry and business leaders in our state. And there's businesses and industry in our state that have mandated that their employees take the vaccine. But the federal government coming in and telling them that they have to require it in terms of a term of condition of employment is just something that Arkansans are not going to be take too kindly to. I think, as I mentioned before, it's going to have the reverse effect, and people are not going to want to take it because of the federal government coming in and trying to mandate that. What Randy has said is spot on. I think you have an opportunity in front of us over the next several months through additional education. Employers mandating it on their own for various financial reasons. That'll help get people to the table and get us over the numbers. As you mentioned earlier, we're over 50% now of the eligible population. I think the numbers are going to continue to move and go up from here, especially as the approvals on the vaccine are given full green light from the FDA. I know Pfizer has, Moderna will probably be next in line. So you're making progress there. And something like this just, to me, it has the reversed effect and is going to create backlash, especially in Arkansas.
There would seem to be among the states, though, Secretary Preston, the state's larger employers, as Mr. Zook pointed out, there are all sorts of incentives or even mandates by larger employers on their employees. Is that not a tacit support of the administration's position? Is business at Arkansas actually quietly supportive of this?
Well, I'd say that on the flip side of it is, what if the federal government came in and said, you can't mandate as a business that you have to require your employees to have vaccines? That would be kind of taking the counter to it. So I don't want to come in and have the government regulate a business to the extent that they're saying you can or cannot mandate vaccines in your facility or for your workforce. I think it's up to that business to determine what is best for them. And in Arkansas, we have seen it. A lot of large employers have taken it upon themselves to mandate the vaccine as a condition of employment, or they've offered those financial incentives to do so. I think too much, government interference and regulation on this is going to have an adverse effect.
Well, as Mr. Zook pointed out just a second ago, the administrative agency that will be handling this is the Occupational Safety and Health Administration. They've got a pretty good track record of winning in court.
That they do. As Randy said, it'll likely end up at the Supreme Court at the highest level, and you're probably going to be split down the middle. And our court's pretty divided. So I'd say it's a coin toss at this point of how they're going to rule. But until that time is done, I see businesses taking it upon themselves to move forward and figuring out how to get their employees vaccinated if that's the choice and that's the route that they want to go.
A question that I put Randy Zook to Mr. Secretary Preston just a second ago, is the political establishment in Arkansas a bit out of step with corporate Arkansas?
I don't know that I'd go that far, Steve. I think there are honest differences of opinion, and I think the thing we need to be careful about is overreacting at a political level. This is clearly an issue for the courts. There is a process. It's well defined. It's predictable in terms of length of time that it'll take. And once we've got that decided, because at the end of the day, whatever the Supreme Court rules, that is the law of the land. And as Mike pointed out, the OSHA laws are long in place and have been upheld by every challenge that's been put to them. So I would just say that we need to be. I think we'd be most helpful if we take a deep breath, let the process play, and not try to, engage in too much political theater around it.
Yeah, in the near term.
Near term.
Sure. Well, I mean, in the near term, Randy, Mr. Zook, how is business in Arkansas dealing with this? Now, we got a new unemployment report out Friday morning as we're taping this broadcast, and we're down, I think, 0.1% again.
We're out of people. That's the long and the short of it in Arkansas for open. We've got 60, 70,000 open jobs across the state in every sector of the economy. This is one of the biggest difficulties and challenges business has ever faced. You've got unprecedented level of need. You've got supply chain disruptions across the economy, every sector nearly. Deliveries of just about anything you want to buy are delayed. And companies, businesses are challenged. Everywhere you go, you see now hiring signs or help wanted signs. And every major employer in the state is needing a substantial number of additional people to get back in the workplace. That's where we're sort of soft right now. We've got our number of what's called the labor force participation rate is a little bit below the national average, about 5 percentage points. So we've got a lot of people who can and are in the age range to get back in the full-time workforce that we need to re-engage with. So a lot of different complex challenges that people face, but companies are finding ways to deal with it, essentially, or especially in raising wages. Wages are going up. That's all there is to it.
Inevitable?
Inevitable. Supply, demand, need, got to have it, got to pay for it, and that's what it's going to take.
Mr. Secretary, the last time you were on the broadcast, you said you saw some, for every state, but particularly Arkansas, you saw opportunity in this. You still do.
I still do, and I'd echo Randy's comments that we still have 70,000 job openings. That's an opportunity to get more people back into the workforce and to fill these jobs. But in the new jobs report that you referenced, we are down to 4.2% unemployment. But if you dig deeper into the numbers, the most positive thing out of that is for the first time in months, we actually saw an increase of people into our labor participation pool. So in previous months, that number had been shrinking. It looks like for at least for this month and hopefully going forward that stopped and turned around some. And, I can attribute to that to the state's decision to opt out of the federal benefits, unemployment benefits early on. We're now seeing those effects of that start to slowly take place. And hopefully over the course of the next couple months, that labor participation rate number will grow in Arkansas and we'll start to fill some of those 70,000 jobs.
We've got about a minute left in the broadcast. Sir, let me ask you this, and Mr. Zook and I were talking about this prior to the broadcast. There are oceans of empty retail space, empty retail and manufacturing space, but especially retail across the state. What's to become of that in the next 5 years?
Well, I think there's going to be a blended model that you'll see people going to, online and retail, but there's still going to be the desire for people to get into storefronts. So there'll be storefronts, so maybe a little bit different from the storefronts we're used to. Think more of like what an Apple store is, where, it's a place where you go in and have conversation and maybe purchase something online. And some of these stores are going to change, but, the face of retail is going to be different. Just how different that's going to be, the next few months to a couple of years will really determine that.
All right, Secretary Preston and Randy Zook of the State Chamber, thanks very much for your participation.
You bet.
And we'll be right back. And we are back, and COVID on a clinical level now. A team of U.S. Army medical personnel has arrived in Arkansas and is assisting local doctors and staff with their coronavirus caseload. That patient count would have been much lower, it's widely agreed, had the Arkansas vaccination been higher, sooner. and there's continuing concern for COVID outbreaks in schools. We're joined now by Dr. Steppe Mette of UAMS and Dr. Joe Thompson of the Arkansas Center for Health Improvement. Dr. Mette, if we can begin with you, I have to believe that those additional hands-on, those trained, skilled hands are making a difference there at UAMS.
They are, Steve. They're a welcome team for our caregivers, our hospital, for our patients. They've made a huge impact already. They've been on site for about a week. Just their being here and the sense that there is a concern from our federal government to send the relief team has done wonders for our morale. And of course, the added help has increased our capacity to take care of patients who need their care, seek their care at UAMS. So yes, a very welcome team indeed.
Well, if we can narrow it just a bit, Dr. Mette, exactly what services are they providing? I mean, are we talking about technicians here? Obviously, it's clinical care.
Right. A team of 20 clinicians arrived. There are 4 physicians, 14 nurses, and 2 respiratory technicians. The physicians are a critical care physician who is stationed in one of our intensive care units. 2 physicians, 1 family medicine physician, 1 internist who are on our COVID units, not in the ICU, but our inpatient COVID units, and then 1 emergency room physician. The nurses are distributed amongst the ICU, the intensive care unit, our COVID units that are not in the intensive care unit, and our emergency room, and the respiratory technicians are deployed throughout the hospital.
I have to believe, though, Dr. Mette, that even with the addition of these military personnel, these trained, skilled military practitioners, that hospital, either UAMS or hospitals across the state, are still stressed in terms of space and particularly staff.
Yeah, more so staff than space. We created here at UAMS a lot of extra patient care space, intensive care unit space, and non-intensive care COVID unit space, as have other hospitals. The limiting factor for us has indeed been to staff the beds. So we're not using all the space that we could because of inadequate staffing. And even though 20 clinicians have been a relief for us, has not been enough to staff all of those beds. And that is a concern not just for our hospitals here in central Arkansas, it's around the state, and indeed we are seeing the same thing around the country.
Well, we reached this past week, it was celebrated, perhaps prematurely, a 50% vaccination rate of those eligible Arkansans. Let me go to Dr. Thompson here, and I'll bring both of you in. Dr. Joe Thompson of the Center for Health Improvement. Certainly it's worth observing, but some have observed that a celebration may not be, it ought to be a muted celebration anyway.
Well, if we have 50% that are protected through vaccination, that means
that's better than 40.
That means we have 50% that may not be protected, and they still are at high risk of COVID-19, the acute infection, and increasingly we're learning about the long hauler, where as many as 10% of folks have long-term problems after they get infected. So we're on the right path. We're increasing our vaccination rates, but anything we can do to accelerate that would be much warranted.
Well, since you brought up the long COVID, Doctor, let me start with you, and we'll go to Dr. Mette as well. Only this Friday morning, I'm reading some new research on the impact on youngsters, particularly. It can be especially egregious, all the way from brain development to obesity even.
Well, we've seen throughout the epidemic that overweight, obese individuals have a harder time. Individuals with comorbidities like diabetes or COPD have a harder time with this virus. We're also learning more. This virus, 20 months ago, we never knew about. Now we're 20 months in, we're learning scientifically, we're learning clinically more about how this virus reacts in our bodies and what it causes in our bodies. So some of these long hauler syndromes actually appear to be inflammatory reactions that cause permanent damage to our lungs, our brain, some of our kidneys and other things. So this is really a disease you do not want to get, and the vaccinations are the pathway to avoid it.
All right, Dr. Mette, back to you. This higher vaccination rate, obviously it's going to give clinicians some breathing room, or absent at least another wave.
Well, certainly every percent increase in vaccination is helpful in decreasing the risk and therefore the numbers of patients hospitalized. As Dr. Thompson said, we have a long way to go to really have the kind of impact that we need. But I'll look at that on the positive side. Any increase in the vaccination rate is welcomed. We continue to hope for a continued dramatic increase in the number of Arkansans vaccinated.
Well, the number, Dr. Thompson, the number of youngsters, and for that matter, teachers, has been recent weeks of months of particular concern to you.
Of course, kids 13 and older now can get vaccinated. 12 and older can get vaccinated, but those under 12 are yet to have a vaccine available for them. And as we came back to school, particularly when we were at this very high peak of transmission at the end of August, there were significant concerns. More than half the school districts have put a mask requirement in place for their teachers, students, and staff. And this is actually, we believe, having an effect. We are down from the peak that we were at in late August. We're still having high levels of transmission across the state, but it's not still on an upward trajectory with more and more cases each day.
Well, we have a map that the center has provided for us, and if you can, we'll pull that up. And Doctor, if you would walk us through that. I assume most of our viewers are watching in color.
So we last year and then reinstituted this summer school district level infection rates. These are the rates of new infections in individuals that live within the school district. So not in the school itself, but what the school district draws from: kids, teachers, staff, others. And obviously the number of infections, the level of infection relates to the risk in the schools. The CDC threshold is very low. It's in that smallest green level, 10 per 10,000, they would say, is high rates of communication of the Delta virus. We scale this so that people could trend over time. In the purple school districts with 100 or more, that means that 1% of the residents of that school district have been newly infected in the last 14 days. So that's an extremely high level of transmission. Those school districts should clearly look to masks and other defensive mechanisms and try to accelerate their vaccination rates. You'll see here we've got some yellow and we've got some orange moving in the right direction. 3 or 4 weeks ago, almost the whole state was red and purple. So we're moving in the right direction, but we've got a long way to go.
For those of us who aren't epidemiologically trained anyway, you say 1% is a high rate of transmission. To the layman, that would say, wait a minute, 1%? That's not very much. Well,
so just to put it in context, 1% would mean 1 out of every 100 people you come in contact with today is newly infected and transmitting the virus. So if you go to a Walmart, you go to a Kroger, you go to a grocery store, you go to a church event, it's likely that there is an actively infected and transmitting individual in that group of people with you. So
1% today equals tomorrow or the next day.
This Delta variant is a very infectious variant. It spreads very quickly, and therefore, if you are unprotected, if you've not been vaccinated, you are at risk of coming in contact with somebody that is transmitting the virus and that you may contract it from. As
Dr. Mette, as Dr. Tom, your colleague, noted, it's vaccinations right now for 13 and above. When can we see that the FDA approve it for 12 and under?
Well, I don't have any special information or knowledge of that. We are hearing that it is likely, or certainly hoped for, by the end of this calendar year, at the end of 2021 or the beginning of 2022, but we have not heard that in certainty.
Dr. Thompson, any different intelligence from Washington?
I think, at least for the Pfizer vaccine, we're hearing that they may submit data later this month, early next month, for the 6 to 12-year-olds, and then following that for those 5 and under. Obviously, the pharmaceutical industry is working hard to get a vaccine, but then we need the independent assessment of the Food and Drug Administration and then the CDC's recommendations for who gets it and at what rate for boosters and other things moving forward.
Right. If I could ask Control Room to put that map back up again, Dr. Thompson's map back up again one more time. What, Dr. Thompson and Dr. Mette, what should that map tell Arkansas?
What I would tell Arkansans is that we are still having a very, very high level of transmission throughout the state. We have almost the whole state in orange, red, or purple, and that is a very high level of transmission. Our 2 tools here are vaccinations to protect people and the defensive measures that we know work: masking, distance, good hygiene. Those are our tools that we have to continue to combat this threat.
And you and other clinicians are running head-on into political considerations. It's inevitable. What is your message to the education of staff establishment?
We are all tired of COVID. There's nobody who likes wearing a mask less than I do, I promise you that. And I think we are making progress here. We are seeing a decrease. We're still at a high level, but we've hit that peak and it looks like we're coming down. If we can hold on for a few more weeks, maybe a couple more months, I think we have a chance to break the back of the transmission here of COVID-19.
All right, Dr. Mette, I'll give you the last word here. Your colleague sees maybe some light at the end of the tunnel. Do you?
I do, very much so. We are seeing a gradual decline in the number of patients, number of Arkansans hospitalized with COVID. We're seeing some slight decrease in the amount of pressure on our healthcare organizations, hospitals, so that gives us all hope. I want to underscore something that Dr. Thompson said, that I'll paraphrase, that even if you are not vaccinated, you cannot, or perhaps you will not, that wearing a mask, paying attention to the distancing and good hand hygiene really are effective tools. And I would urge everybody to continue those techniques, those strategies. We're all tired, but we'll get through this. Let's get through it together.
All right, Dr. Steppe Mette and Joe Thompson, both of you, thank you very much for being part of the program. Come back soon. Thank you for watching, as always. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.